Welcome to Save with CPR's Opioid Overdose course. In this course, we will get an introduction to opioid overdoses, opioids and their effects on the body, how to recognize an opioid overdose, how to respond to an opioid overdose, how to perform rescue breathing, some common myths of opioid overdoses, and then we'll review the material we've learned. This course will prepare you to respond to a person suffering from an opioid overdose and potentially preventing their death. Opioid overdoses represent a critical medical emergency with profound implications for public health and safety. Defined by the excessive consumption of opioids, these overdoses can result in life threatening complications if not properly recognized and addressed. From prescription painkillers to illicit substances like heroin and fentanyl, opioids encompass a broad range of drugs that exert powerful effects on the central nervous system. By gaining a better understanding of opioid overdoses and equipping ourselves with the necessary knowledge and skills to respond effectively, we can play a vital role in saving lives and combating the opioid crisis. Opioids are a class of drugs that act on the body's opioid receptors, primarily located in the brain and spinal cord. These receptors play a crucial role in regulating pain perception, pleasure, and mood. When opioids bind to these receptors, they can produce a range of effects, including pain relief, euphoria, and sedation. When opioids bind to opioid receptors, central nervous system or CNS depression occurs. The CNS depression causes a decrease in a person's alertness, causing drowsiness and potential unresponsiveness. Additionally, the patient's respiratory rate, or how many times in 1 minute you breathe, also goes down. Your body requires oxygen to maintain normal function, and we receive that oxygen every time we breathe in. So, what you get in an opioid overdose is someone who loses awareness and experiences a decrease in oxygen intake. Their body continues to function until it is ultimately starved of oxygen and the bodily systems start to fail. A person overdosing will have a period where the overdose can be reversed and they can be saved. At the onset of the overdose, they will lose alertness and their breathing will slow or even stop. Without intervention, their body will starve of oxygen and their heart will stop. It is in this period that you can save them. Before we can save somebody from an overdose, we have to know what an overdose looks like. A person experiencing an opioid overdose may still have a pulse and exhibit any combination of the below signs. Pinpoint pupils, that means they're very small, they do not react to light. They're not breathing, or they have very slow breathing. We call this apnea. Altered mental status, unconsciousness, essentially they're not responding to you. And cyanosis. Cyanosis is a blue color to the skin, especially around the lips and fingertips, which indicates hypoxia, which means a low oxygen saturation in the blood. The most powerful sign of an opioid overdose is pinpoint pupils. So if you have a patient with pinpoint pupils, they're not responding, you're having a hard time telling whether they can breathe or not, that is an opioid overdose. So now that we've learned about recognizing an opioid overdose, how do we respond to an opioid overdose? But first, I want you to be mindful that there may be drug paraphernalia that could injure you, such as unprotected needles. When responding to an opioid overdose, remember the following things. First and foremost, call 911. By activating EMS, you'll get first responders there quickly. And if this is not an opioid overdose, that's okay. You can always send them back. If this is a true medical emergency or an opioid overdose, you will want those first responders there. Next, if you're comfortable and able, check for a pulse. This may be the definitive way to differentiate between an opioid overdose and somebody who's in cardiac arrest and needs CPR. If you feel for a pulse and you do not feel a pulse, start chest compressions. Then look for the four signs of an opioid overdose. They are pinpoint pupils, apnea, which is not breathing or breathing very slowly, altered mental status or unconsciousness, essentially they're not responding to you, and cyanosis. So if you identify the signs of an opioid overdose, we're going to want to do two things. First, if comfortable, provide rescue breathing with one breath every 6 seconds. We'll discuss that technique next. Then, if available, provide Narcan or naloxone. This is a medication that will help reverse the opioid overdose. Rescue breathing will allow you to replace depleted oxygen in the victim's blood. Three options of rescue breathing exist: mouth to mask, and bag valve mask. With either technique, you will want to provide one rescue breath for every 6 seconds. Mouth to mouth and mouth to mask are substantially similar. We'll consider them as one technique here. The difference being you would have a barrier device between your mouth and theirs versus not. So in mouth to mouth, pinch the victim's nose closed, tilt their head back, place your mouth over their mouth, forming a seal. Exhale one breath into their mouth, watching for chest rise and stopping when you see the chest rise. In an opioid overdose, you will deliver one of these breaths every 6 seconds. If available, you may use a bag valve mask or BVM to deliver rescue breaths. To use a BVM, place the mask over the victim's nose and mouth with your thumb and index finger, using enough pressure to form a tight mask seal. Then, tilt the victim's head back while keeping a tight mask seal. Deliver one breath over 1 second, stopping when you note chest rise. Then release the bag for 1 second, allowing the victim to exhale. You may repeat this once every 6 seconds until help arrives. Administering naloxone, a life-saving medication, is crucial in reversing the effects of an opioid overdose. Naloxone can be administered via prepackaged nasal spray by non-medical personnel. When you suspect an opioid overdose, call emergency services immediately. Administer the naloxone by placing the nozzle of the nasal spray into one nostril of the victim and pressing the plunger firmly. Observe the person closely. If there is no response within 2 to 3 minutes, administer a second dose. Naloxone temporarily relieves the overdose effect, providing critical time for medical professionals to arrive and offer further treatment. It is important to stay with the person until help arrives, as multiple doses may be required to keep the person stable. Let's take another look at the atomizer and how to use it. Now that we can recognize and respond to an opioid overdose, let's talk about some common myths. Common myths about opioid overdoses persist despite efforts to educate the public, so let us address and dispel some of these misconceptions. Myth 1 is that opioid overdoses can only happen to people who use opioids regularly or are addicted. In reality, opioid overdoses can occur in individuals who use opioids infrequently or even for the first time. Anyone who consumes opioids, whether prescribed or obtained illicitly, is at risk of an overdose, regardless of their level of use or addiction. Myth number 2 is that opioid overdoses are always fatal. When in reality, opioid overdoses can be life-threatening. They're not always fatal, especially if prompt medical intervention is provided. The timely administration of naloxone, along with appropriate medical care, can reverse the effects of an opioid overdose and save lives, especially what we discussed today. Administering naloxone and delivering rescue breathing will save a life. Myth number 3 is that it's safe to consume opioids with other alcohol or drugs, when in reality, combining opioids with alcohol or other central nervous system depressants significantly increase the risk of overdose and death. Mixing these substances can potentiate the sedative effects of opioids, leading to greater respiratory depression, coma, and even death. The fifth and final myth is that once someone has been revived with naloxone, that they're out of danger. While naloxone can temporarily reverse the effects of opioids and restore breathing, its effects may wear off before the opioids fully metabolize out of the victim's body, putting the individual at risk of re-entering an overdose. It is essential to seek emergency medical attention after administering naloxone to ensure the person receives comprehensive care and monitoring. Dispelling these myths is crucial for raising awareness about the realities of opioid overdoses and empowering individuals to take appropriate actions to prevent and respond to these emergencies effectively. Education coupled with access to naloxone and comprehensive treatment services is essential in addressing the ongoing opioid crisis and saving lives. Now that we've learned how to recognize and respond to an opioid overdose safely, spend some time, pause this video, and review the 2 questions that you see before you.